So today we had a really exciting convening where we're looking at launching our new population health initiative. So we had a group of our advisors, we had experts from industry, from academia, from our agency partners, really talking about the nexus of population health and climate change and what we can do in this important area to actually make progress towards improving health of our communities both regionally and globally. And we're really focusing on climate right now because climate health is really critical to population health and so many issues of health disparities.
Well, I think that if you're talking about climate specifically, you're talking about the impact it's going to have on Miami Beach and then, of course, inside the Bay and the first areas to be flooded. And so areas that are for people, unfortunately, in some instances, that are very low power, low income, etc. And so therefore, what are you going to do to change their living conditions so that they maintain quality of life and good health despite dislocations? We have enormous capabilities in this area. We have very advanced programs in our environment and program, and therefore I think that we are going to be able to supply critical information as we go forward with all this, because that's what you have to debate with, to argue with, to make the case for making change. You have to have data.
COVID-19 made it clear to everybody why Population Health Initiative is very important. But I would like to work with Florida, not to tell them what we did and how we did it, but more to learn from their experience. We're serving different populations. One, we're tackling different challenges. And we are in a different part of the country where the problems that we are facing are totally different. None of us live by himself or herself. What will affect Florida will affect me in Washington State. And what will affect Florida will affect a lot of countries in South America and Africa and the Middle East. The experience that we will learn from Florida will help other countries.
But in South Florida, the issues of heat and water level are really evident. And so we're probably experiencing them ahead of time of many other areas. We're going to be able to document what those effects are. We're going to be able to test remediations and prevention efforts that could possibly then serve as models for other areas to address.
Climate change is now, but also importantly, equity issue. Globally, low and middle income countries have an outsized effect in these countries. You're going to expect increased 122 million in extreme poverty, hunger, gender equality, reducing inequality. The consequences are huge.
Collaboration is critical. Finding partners at every sector is going to be critical for this initiative to succeed. So I'm looking forward to seeing where it goes and how FIU is able to build those partnerships in the community, in the private sector, in the healthcare sector, in government to make it happen. And so looking forward to learning more about it.